Florida Nurse Practice Act Analysis. Chapter 464 of the 2015 Florida Statutes is devoted to nursing and may be alternatively cited as the Nurse Practice Act, NPA. It is aimed at eliminating the danger of incompetent nurses practicing in Florida. Therefore, the minimal requirements for Florida nurses are determined by NPA. Authority. According to Regulation 464.006 from Chapter 464 of Florida Statutes, the rulemaking authority concerning nursing in Florida is granted to the Florida Board of Nursing. The procedure of appointment and the terms for the board members are regulated by NPA as well. Requirements to renew a license. According to Regulation 464.013, to renew a license, a receipt of the renewal application is needed along with an appropriate fee. Licenses are expected to be renewed biannually. Apart from that, a 30-hour continuous education can be expected from a practitioner, and completing this training is necessary for a license renewal. This is true for most practitioners except for the nurses who have received a certificate of a specialty program that is accredited by the National Commission for Certifying Agencies or the Accreditation Board for Specialty Nursing Certification. The violation for fraudulent use of RN, LPN, and ARNP credentials. According to Regulation 464.016, fraudulent use of the credentials of any medical practitioner status, including but not limited to those of a registered nurse, licensed practical nurse, and advanced registered nurse practitioner, is considered a felony of the third degree. Relevant actions include practicing any kind of nursing, advanced, specialized, professional, practical, without being licensed to do so, using a suspended or revoked certificate, employing persons in the field of nursing without suitable licenses, obtaining, or attempting to obtain, a nursing license with the help of fraud. Apart from that, using the titles described by the definitions part of the Act without suitable licenses, as well as knowing of any of the mentioned frauds, is considered to be a misdemeanor of the first degree. Sexual misconduct. According to Regulation 464.017, sexual misconduct in nursing involves breaking the trust that is supposed to be the foundation of the relationship between a patient and a nurse. Put crudely, sexual misconduct presupposes persuading, or attempting to persuade, a patient to engage in any kind of sexual activity with the nurse. However, the activities that are a part of the examination are not considered to be sexual. Apparently, this kind of misconduct is prohibited. Adding to the Florida Nurse Practice Act. NPA is an act that appears to present consistent and accurate information in appropriate volumes and is capable of providing answers to most questions that may arise concerning the mentioned issues. It includes definitions, information concerning licensure and certification as well as the renewal of the licenses, the actions that are considered to be violations, and the corresponding penalties, along with relevant exceptions. It should be pointed out that these sections appear to fulfill the purpose of providing minimal requirements for nursing practitioners. In case one finds it possible to broaden these limits, it seems logical to mention ethical issues. The specifics of their profession make ethical conduct especially important for nurses. Ethics is a significant part of a nurse practitioner's education process and professional identity. Therefore, short notice concerning the minimal requirements for Florida nurses in this respect could also be included in NPA. For example, the Act could suggest a code of ethics that is considered advisable for Florida nurses.